assalamu alaikum, Jianu, Pakhera Galeni, how much, Uneshume, Washmale, Ohio, Gonzaimus, and highs, hugs, and hellos to all those pretty faces who are actually glued to their television screens just because of the fact that they wanted to watch World this morning on PTV World with Shazad and Maha. Hello, Maha. Good morning. How are you?
I'm good, Shazad. How are you?
Absolutely not perfect.
Why? Why are you not perfect today?
Dude, I do not really know how to say it, but I've been missing out on my gym routine.
Oh, gosh.
And I just feel so sleepy, sloppy, and then very lethargic as well. I do not know what's going wrong because for the last year and a half, I've been going to gym regularly. Well, not even regularly, well, 4 days a week, but I used to feel fine. But now I've missed out on my gym, missing it out, and then I just feel sleepy all day long.
Okay, well then you need to get more active, really, don't you?
Yeah,
and this is self-inflicted laziness. But at the end of the day, your health is really important. And Shazad, if you're going to be lazy and not feeling perfect, then every day of your life is going to be affected by it. So, in Pakistan, we have a lot of issues regarding health.
Exactly.
And, today is actually World Health, it's a World Health Day. And the World Health Organization is observing action needed to halt rise in diabetes because globally it has quadrupled the figure of people suffering, adults suffering from diabetes has quadrupled since the 80s. So we are over almost 150 million adults suffering from diabetes these days.
All right, but then at the same time, 420 million cases of diabetes in 2016, where 1.5 million people actually died because of the fact that they didn't take all of those prevention or precautionary measures.
Exactly.
And then if we talk about Pakistan, we roughly have, these are the figures of 2015, 7 million cases of diabetes, but there is a cure for that. And you can probably beat diabetes as well.
Okay, well, I don't know if we can go as far as saying there's a cure for it, Shazad.
Yeah, we can.
Well, we'll discuss that.
Let's be optimistic.
Well, there's not a cure yet, but we are working towards
All right,
it.
let's ask the experts.
We will ask the experts. But also another alarming figure is that 90% of people in Pakistan suffering from diabetes is type 2 diabetes. And also, that means that you're passing these genes on and then your children have a higher chance of getting diabetes as well. So to discuss the situation within Pakistan, how can we decrease the speed,
the number of cases,
and also, what can we do in order to live a better lifestyle? So for that, we have been joined by Salman Ghani. He is a stem cell consultant. Assalamu alaikum, good morning. Thank you for joining us.
Thank you very much for having me.
Besides Mr. Salman, we have been joined by Dr. Rehan Uppal. He is a medical specialist and a general practitioner. Assalamu alaikum, good morning.
And
Thank
Dr. Usman, we do miss you too as well.
Yes, we do.
So if you're out there, and if you're watching us, we are glad to have Mr. Rehan on the show as well. But right now, ladies and gentlemen, we just need to go for a short break. We'll be right back. Don't go anywhere because we're disseminating information and it's your right to collect it. And it's our right to disseminate.
Stay tuned. Welcome back, everyone. And we went for a short break, but we have also been joined by our third guest, who is Dr. Mubashar Bhatti. He is an integrated medical consultant. Assalamu alaikum, good morning.
Thank you very much for being on the show, and it was very difficult for us to understand what that is. So probably, if you take it away for us as well and for all those amazing viewers who are out there so that they understand what you're trying to do over here.
Okay, so what is an integrated medical consultant? Just very briefly.
The consultant who addresses the disease as a whole by integrating conventional medicine, with the sensitive evidence-based other modalities like nutrition, diets,
Okay, great.
to address the disease as a whole.
Okay,
Very
wonderful. So that
nice.
fits in perfectly with what we're going to be discussing today. So I'm going to start my conversation with Dr. Uppal. Within Pakistan, diabetes is quite a serious issue. But for all those people watching right now, what is diabetes and how does it actually affect us?
Yeah. Diabetes is a metabolic disease where the metabolism is basically affected, and that leads to persistently raised level of sugar in the blood.
All right.
And that causes, if not treated for a long period of time, causes multiple issues, organ damages, and different other complications. And it is definitely a global challenge now in this time, because the diabetes is not only prevailing or increasing on the increasing side in Pakistan, but on the global side as well.
Alright.
Because in 80s it used to be less than 100 million, and now it is more than 400 in the figure.
Exactly. But then, who's more prone to get diabetes?
There for a metabolic disease, basically there can be many factors, but generally the lifestyle, what we are basically having these days, the sedentary lifestyle, stressful lifestyle, and eating habits, use of medicines,
Okay.
self-medication. So
Okay, in regards to the lifestyle, how big a factor does genetics play in regards to getting diabetes?
exactly, there are two main factors. One is the genetic factors, which is basically coming from the family side. It's a fixed factor which we cannot change, and then comes the modifiable factors. And in those modifiable factors comes the physical activities, eating habits, smoking, obesity. These are the predisposing factors which eventually leads to diabetes.
But then I just want to pick up on stress. How can stress be one of the core reasons
Yeah.
to probably get you diabetes, or probably get you...
Exactly.
Because it's a very not taken seriously.
Yeah.
Stress is just like, oh, don't be so, it's just don't care about something.
As I earlier said, that it's a metabolic disease.
Yes.
During the stresses, there is increased amount of catecholamines and cortisol secretion in the body.
Alright.
And those cortisol and catecholamine, when they are on the rise side in the body, they convert the other cells, gluconeogenesis, and there are different technical terms which I think will not be very easy for the viewer to
And for us
understand.
as well.
And for you too. So basically, the stress causes increased level of cortisol level, and that increased level of cortisol leads to higher level of sugar level.
Okay, interesting. Now, let me bring Dr. Mubashar into the conversation. Regards to, as Dr. Uppal said, our diets and our current lifestyle, over the last, 20, 30 years, our lifestyles have changed. Obviously, that's why we've seen the increase. What has changed between the 80s to 2016 in our eating habits that are causing people to get diabetes?
That's great. Well, one information I'd like to add on that. In 2014, the Yale University Preventive Care Department, they have a research paper published in the Time magazine too. They're indicating more than 50% chronic diseases there because of our lifestyle.
All right.
And the major factor which diabetes is contributing, the people, because of this fast food, their physical exercise, they are not as much as before. Their habit to have the junk food, and the habit to have the modified food,
Yeah, not organic.
yeah, this is more in practice as compared to the previous decades, what we are talking about.
Okay.
So these factors, we are thinking they are very small factors which have the chronic impact leading to chronic diseases.
All right.
That's the reason, if you go back a couple of decades, the infectious diseases, they were the epidemic in this world. Now the threat to the world is the chronic diseases.
Yes.
Yes.
So now the lifestyle, diet and nutrition, their contribution to the human body in this time leading the chronic diseases is about 80%. Even that report saying one thing more, 10 to 20% deaths in US, even they were premature deaths.
Premature death.
Premature death means maybe the deaths was not expected because of the chronic factors leading to the other contribution, say which is the diabetes, have the bad effect to the kidney, have the bad effect to the heart, the cardiovascular system, all small area which we never focus on that, leading to the chronic pattern to have the whole body going
Yeah,
down.
that's what I want to pick up on. Now, for example, when you say chronic impact of whatever we do in our daily routine, what type of impact are we talking about over here? Because chronic, it seems very general, but what happens? For example, I eat fatty food, I do not use the right oil, I do not eat organic. What happens eventually? What is the system? How is it like?
If we are focusing on the diabetes, the day we are
Yes, today, yeah.
But it's World Health Day.
in my R&D workout and my practice, which I learned, the chronic impact in the diabetes, when we have the glucose, the carbohydrates, more impact in the cardiovascular system, which is vehicle of all the food to the nervous system. The major factor on the myelin sheath, leading to the sluggish impulses to human body muscular system, that slow down the cellular activity, having the less flush out of the toxins and less intake of the ingredient which is basically giving the life to the cell.
All right.
That slow down the process of the human redevelopment or the restructuring of the cell, which is continued process of the regeneration, affecting the quality of the life and the time of the quality of the life, leading to the other chronic diseases like arthritis, you can the heart disease, you the kidney
Very well
problem,
Exactly.
the liver problem, the neurological problem. That's the reason even in Pakistan, we have more than 50% mental disorders. So
And even then, people just do not go and probably consult a psychologist or a psychiatrist as well because there are stigmas attached to that. But moving back to Rehan Sahab over here. Now, Rehan Sahab, how many different types of diabetes are there which are prevalent within our country?
There are broadly two types of diabetes, type 1 diabetes and type 2 diabetes. And the third one is the gestational diabetes. So the type 1 diabetes is a type of diabetes where there is no insulin in the body. The beta cell are not able to secrete insulin. And that is usually less common. And the commonest type is type 2 diabetes, which is more than 90%, not only in Pakistan, but across the globe. And in type 2 diabetes, the issue is that the beta cells are not producing that good amount of insulin, or the secreted insulin quality is not that good. It is a resistant type of insulin, which does not has the capacity to penetrate to the cells.
Right.
So broadly, we can say there are two types, and then the type 1 diabetes usually affects the patient which are less in age, like less than 40 years of age, and type 2 diabetes mostly affect the elderly age, more than 40. Even in 25 and above age, we have seen type 2 also.
Okay, we're going to discuss that in more detail in a bit, but I want to bring Dr. Salman to the conversation.
Finally,
It's
a
been a
smile
while.
on his face as well.
Yes, very happy this morning. But now I want to bring, because you are a stem cells consultant, now how does stem cells play, because I don't want to get to a treatment aspect or, discussing if
Not
there's
right
a
now.
cure or not, but how does stem cells play a role in, if you have diabetes, can you get treatments, etc.? How do they play how do they work together?
Okay, since it is World Health Day,
Yes.
and my prime specialty is I'm a medical specialist, so I'll talk about diabetes and metabolic syndrome in general first,
All right.
and then I'll talk about
Take it
stem
away.
cells, how can they help. As Dr. Uppal was saying, that there are two types of diabetes, type 1 and type 2. Type 1 occurs when your beta cells are destroyed by your own immune system and you don't have any beta cells to produce insulin. And that occurs in your teenage. Whereas type 2 diabetes used to happen after 40 years of age. But you were asking me, how does lifestyle play a role in diabetes? In US, they have actually, the people in US have actually changed the definition of type 2 diabetes, where I have actually seen patients as early as in their 20s having type 2 diabetes. And that is because of their lifestyle changes. Because they're not eating right, as you were mentioning, and they're not doing any physical activity. There is no exercise. Both of these things, in the end, put a lot of stress on your pancreas, which causes diabetes. And the only way we can get out of not having diabetes, so to give you an idea, a person has diabetes when he's born, he or she's born.
Really?
But the symptoms, or when you start having the symptoms of, and when you get to know you have diabetes, is usually in your later ages, in the third or fourth decade.
Okay. Well, I did want to move on to detection of diabetes.
Right.
You were already talking about it, so go ahead.
Right. So, well, a simple blood test can tell you if you have diabetes or not. But what I'm trying to say is the people, you know, in the 80s and the 70s, they had the symptoms of diabetes after they were 40.
Yeah.
And now we're having diabetes as early as in the early 20s.
Yeah.
So on World Health Day, my message would be to beat diabetes by lifestyle modification. Because right now we talk about it is a microvascular disease, which means it affects your small blood vessels.
Okay.
And you have blood vessels all over your body. So it affects every single organ of your body, diabetes.
Okay,
And
but
that's why.
now what I want to ask is that you just mentioned that, you know, when a boy or a girl is born, they have diabetes and they know it in the
Genetic,
later
yes.
decades.
Yep.
How? I mean, explain this.
No,
please.
no, it's
Genetically.
not, like if you're going to have diabetes, you have it when you're a child. Is that what you're saying?
Yeah.
Or you're saying that every child is born with diabetes?
No, not every child.
Right, just clarify, because I think there was like...
So then for all
No.
those parents who are actually expecting or who have babies, can they do something about that right
So
now?
then let's talk about the detection of
Yeah.
this. So how early can one start to do the detection process? Like you said, it's a simple blood test.
Yeah. Yes.
So at what age should one start?
Because over here, we do not really have a practice
thing
of
is-
going to
yes.
go visit a doctor, get ourselves
So
checked regularly.
that brings us to the other point, which is very important, is prevention.
Thank you.
Unfortunately, in Pakistan, there is not a lot of effort done on prevention of any disease.
Right.
Diabetes being a prime example of that. If we have yearly exams, yearly examination by the doctors, we can detect diabetes at a very early stage. We call it pre-diabetes, when your glucose levels are starting to go up, but they're not in the abnormal ranges.
Right.
If we start the lifestyle modification at that stage, we can delay diabetes
Okay.
for as long as 10 years.
Okay,
but then-
sorry.
yeah, go ahead,
But
go
in
ahead.
order to know whether you need lifestyle changes and prevention, then you need to have a culture of going to a general practitioner. Maybe every 6 months or every year, like you do in UK. But now let me ask Dr. Uppal, because now we moved on to the preventative measures. When patients come to you, when you see that there is a history of diabetes and their lifestyle isn't good, what do you tell them? They should go for tests. How should someone with diabetes in their family live their lifestyle from their 20s onwards?
Okay. Basically, there are two types of prevention, the primary prevention and the secondary prevention. The primary prevention is a type of prevention. For example, if I know that I have a family history of diabetes, I will be more focused on my lifestyle, my way of eating, my activities, and then is the secondary prevention. Secondary prevention is a type of prevention. For example, if I have a family history of diabetes and I myself am affected from the diabetes, then I will be more focused on my own diabetes.
All right.
And my target and criteria of controlling that in secondary prevention will be different from that which is in the primary prevention.
We'll definitely talk about that, but now the problem over here is that we do not have any idea whether our great-grandfather had diabetes or great-grandmother or grandfather, because of the fact that, your family had a different lifestyle and they had a practice of going to the doctors. Over here, we did. So what do we do about this? This is what we're going to discuss right after a very short break. Don't go anywhere. It's World Health Day today. Good morning.
Welcome back, everyone. And we went for a short break, but today we are observing World Health Day, and today's focus is trying to halt the rise of diabetes, which is increasing at exponential rates at the moment. It's quadrupled since the 80s. So we were in discussion with our panelists. Now, I just want to ask Dr. Uppal, the symptoms that one needs to be aware of. What are those in regards to detection of diabetes?
Symptoms vary in different age group, but generally lethargy, feeling of unwell, weakness, excessive thirst, excessive urination. These could be the symptoms, even recurrent infections, repeated UTIs,
Okay.
unable to heal a lesion on the time, and even in terminal cases where they, for example, a patient can present even in the state of coma in emergency.
All right. Just because of diabetes.
Just because of diabetes. For example, in early age, as a parents, we seldom believe that the kids can be affected with diabetes. And once they are having the rising type of sugar level in the blood, and at certain level of blood, there becomes the ketoacidosis and hyperosmolar
All right.
coma state, where the levels are very high, and patient even can present in that state too.
Okay, so now the only problem.
I'll probably
Yeah, sure.
say about the symptoms, because you were asking how do we know that we have diabetes. So the initial symptoms is if you have increased hunger, increased thirst, and increased urination if you have to go to the bathroom. These three symptoms, go to the doctor and get this blood test done.
Right.
That is the message to general.
Okay, but then at the
Very
same
few
time, you
simple
know.
rules. Dr. Bhatti, would you like, sorry.
Yeah.
I feel like everyone wants to add something.
I so want to move on to Mr. Bhatti, but Mr. Bhatti, just give me a minute, all right? And my question originally was that, you know, we do not know whether 3 or 4 decades earlier our great-grandfather or grandfathers had diabetes or the family history. It's nowhere to be seen. So all we can look at is probably our father or our uncles or mother or aunts. That's it. So how do we figure it out whether it was in the family or not if somebody has not ever been diagnosed with diabetes?
It's going to anyone can
Yes, that's what I just said. You know, so if you don't know
Yeah.
about your family
And I've
history,
got-
and you have increased thirst, you're thirsty more than you used to be,
All right.
and then you're feeling more hungry, and then you need to go to the bathroom very frequently to urinate. Then
It's
you know
very
you
simple
just,
triggers.
yeah.
Dr. Paul, you want to...
In fact, in our region, we live in Southeast Asia, and this region is already prone to and very common to have the metabolic syndrome as well. Metabolic syndrome is a condition where patient is having high level of cholesterol, high level of sugar level, and there is increased visceral fat, especially the abdominal girth. So we, as living in this region, having this all history, we should be more careful that we might
Exactly.
have this sugar.
And then picking up on being careful, you know, the other day I was reading an article and there was a picture shared of a fast food chain and there was a billboard right underneath it, and it said that our food kills 99% more people than cancer or diabetes.
Oh, gosh.
So Dr. Mubashir, is it true or not? Can it be true or not?
And this is absolute fact. The scientific community saying, you are what you eat.
Exactly.
Okay.
Right. So this answer of your thing is 100% correct. So one thing is very important. We have this discussion, you know, Dr. Usman said the 3 to 4 decades, you know, maybe earlier, the kid has diabetes when he born. I can think this thing can go to every chronic disease, cancer, hypertension, blood pressure, all these things. So we should not focus on that much. Disease is carrying in the genetic system is predisposing factor.
Yes.
You can say that somebody has a tendency or that typical organ is a little weak as compared to the others. So the factor behind the genetic, the chromosomal level, the stem cell. I have a training of a stem cell from Germany and from China.
Very nice.
So I have the couple of conferences in Pakistan for stem cell. So the stem cell we're talking about, the way we're talking, the stem cell carrying these couple of decades before, all basically predisposing factors. What chronic diseases have the outcome out of that? The outcome, the way we live, and is the regional too.
Okay.
Being a president of South Asian Academy of Physicians and Surgeons, I have all this interaction of all these South Asian countries. In all my lectures, I say one thing: diseases are regional; they are not global. The diabetes predisposing factors of Potohar region may be different than the Peshawar or Punjab or Karachi or India, Bombay or Delhi or Sri Lanka.
I mean, region can be such a macro term to be used, but I think it can vary from individual to individual as well.
No, the thing which I'm talking is very important.
Okay.
Is the regional.
All right.
I give them one example. If in South Asia, we have the culture, environmental, water, all the factors basically little common altogether. If in Potohar, we have some surplus are deficient.
Yeah.
Give an example of, we have the deficiency of magnesium, zinc, extraordinary, and our lifestyle is not basically healthy.
Right.
We can have even diabetes with that.
Yes,
Because
exactly.
these small micronutrients sometimes they become a cause of the weakness of the pancreas.
Okay. Now, no, so these are all the factors. So let's, that's the situation right now. So that's what we've seen. We've seen lifestyle change. We've seen, geographical locations, etc. We've seen, genetics, etc. But that has led to 433 million people approximately suffering from diabetes. So now we've talked about the reasons, we've talked about the causes and the symptoms. Now let's talk about the positive aspects. So what are the treatments out there and what is the management? Because in order to halt it, right, we need to know how to manage it.
Yeah, and before we start doing that, can we actually have a transplant of our genes as well if we know that, our grandfather actually
Yes.
had it? Really? Yes?
Wait,
Wow.
what do you mean?
That can be an
What do you
evolution.
mean? Clone yourself?
This is
Yeah.
the fact.
Let's see.
Right now, in one of my conference in China,
I'm confused.
the gene vectors, they develop this just like stunting in the heart, exactly like that. Globally, there's a couple of organizations that they're conducting very successful experiments on that part. So they have the
Just like they do it in X-Men, Spider-Man. So you can probably be a superhero one day.
So basically, if you have the
maybe
genes within you, he's saying, can you get them removed? That's his question.
you can
No.
you can induct like
Right.
stunting in the genes in the pancreas, and there are a lot of good results.
Okay,
Alright.
so let's discuss this now. Let's talk about treatments and management of diabetes. So let's start with you, Dr. Salman. Bring stem cells into it because I'm very curious how stem cells comes into diabetes.
Okay.
Can it cure it because it cures a lot of things? Or?
Yes, okay. As far as a cure for diabetes is concerned, through stem cells, it is very near. Right now, what we're working on is beta cell transplant. So we actually transplant the beta cells that produce insulin, and once you have abundant supply of your beta cells that produce insulin, you can cure diabetes.
Right.
But it is not available for use in the clinical practice yet.
Right.
So we still have to wait a few years.
So then
before
how
it
can we
becomes-
cure it? You just said we can cure
No,
diabetes.
no, that's
Okay,
working
we're
on
working
it.
on it.
All right.
God.
And how long
Very
do you
soon.
think it's going to take?
You cannot say, but it'll be very soon.
Okay.
Like in a few years, as opposed to decades.
Right.
Okay.
We're so close to
So
it.
technology is really advanced.
Yeah, absolutely. Technology
Okay,
is-
but I know that there's always been a contradiction in between allopathy and homeopathic as well. But then Uppal Sahab, what I want to know is that since I've seen you guys practicing homeopathic medicine as well and then allopathic side by side. Is there any cure in homeopathic for diabetes?
No.
No.
In fact,
There's
diabetes.
no cure.
There is
Let's
no
get
cure.
that out there.
No, there is no cure.
I'm just being
Anyone who
optimistic.
says it out there, the specialists have said there's no cure.
But you can extend
Any
it.
research out there, there's no cure. Anyone who tells you, there's no cure.
For all those people with diabetes out there, you can extend it, all right?
Yeah, you
Be
can
positive
learn,
about
but
it.
there's no
Learn.
cure. Yeah.
Basically, we can improve the quality of life.
Yes.
All medicines, they are focused on one point, that is to improve the quality of life. Even the regenerative medicine of stem cell, which we are talking about, is a very evolving medicine. And definitely for these type of issues, there is a room of further improvement and positivity in the coming days.
Great.
But for diabetes, as we were talking about the prevention, I think for the treatment, the basic pillar is the prevention again, I would say. If I remember
I
my
think it's
time.
the only pillar.
Yeah, if I remember my time, our time, we used to be in the schools where there used to be big playgrounds and stuff like that.
Yes.
And in this time, unfortunately, the kids are compelled to stay in their smaller rooms.
Yeah.
And these are the habits time. This first 10 years of life are the habit building time. And these new generations not exposed to those type of physical activities, which fortunately we were having.
Right.
And while coming back to the home, they are again restricted. They use their Facebook tab and
Yeah,
Candy
exactly,
Crush like
social
stuff.
media.
And
To give you an idea,
Yes.
the kids won't go out and play football in the ground. They'll play it on their iPad.
Yeah, then let's ask the president of the Doctor Society for the entire South Asia if he's done something in that or not. Are you trying to go and consult HEC or probably the lower, whatever the organizations are, and tell them that you need to have playgrounds or probably pass a policy on that?
Positively, I think there's one plus point. I'm recently appointed as a member for Pakistan National Commission for Human Development.
Congratulations, you're treating us after the show.
So yesterday, even with the Chief Commissioner Sahab, I was requesting him, we should have to, for example, in Islamabad, we say the ideal city as educated people, we need a smart task team who can work on the prevention.
Okay.
The second, we all friends are talking about the treatment.
Yes.
I can give the one good hope on that part.
Yes.
And I have a lot of examples, and the global have these examples, not me too on that part. When we're talking about the stem cell, is the regeneration of the new cells by introducing the stem cell to the body as a whole, not only with the beta cells. So where there is a deficiency, stem cell complement that to regenerate the pancreas if somewhere the deficiency is.
Okay.
Is the one hope. There is a lot of examples. We have a lot of data on that part globally and different countries. Personally, I have my personal experience on that.
Yep.
I have the collection of the data, and the people have the huge benefit of the reversal of that.
But you didn't really answer what I asked.
Okay. No, but
Let me complete now. Please,
Okay,
please.
we
There's
have to
good
go for a
hope
short
on that.
break.
Okay, we'll give you a fair opportunity to complete your
Yes.
answer, but right now we need to go for a short break. So, Maha,
yes, let's go for a short break. Shazad, you did it anyway, so let's go. And when you come back, we have some more questions. Stay tuned.
The smiling faces of Pakistan. ETV World, changing perspectives.
Welcome back, everyone. And before the break, we were in discussion about how to prevent and reduce the numbers of rising in diabetes. So, Dr. Mubashir, you're talking about particular treatments. Talking about stem cells is a very good option.
Correct. This is the one area which is basically in regeneration medicine is very much known globally at this moment as a new hot topic.
Yes.
The second, to me, where I have my personal experience and education in this background of the research and development sector in 13.5 years in US,
Yes.
but I learned certain deficiency factors. I can give one example. It's the one amino acid cysteine precursor. This basically the building block for the master antioxidant in the human body. Because of the deficiency, due to the certain environmental threats, this deficiency leading to also a lot of chronic diseases. So the doctors should have to focus on the basic things, what factors basically contribute to that region typically. The heart factors, the nutrition factors, the deficiency factors, the excess factors. Certain area, they have the excess of the certain nutrients. They basically also have the bad effect to the human body at cellular level. If there is a deficiency, that lead to also the sickness not to have the proper functioning on that part.
Right.
So the medical community should have to focus on this area too.
Okay.
If the region has a certain deficiency factor, they should have to convey this message to the government sector also for the purpose of prevention and the treatment too.
Okay. Okay, we'll talk about the improvements that need to be made in regard to treatment and the all the stuff and detection, etc. But in regards to the treatment and stem cells, as Dr. Bhatti just pointed out, there is no cure yet, but there are treatments through stem cells.
Yep, absolutely.
So could you tell us about
There
that?
are treatments available through stem cells for diabetes patients.
Right.
And
Type 1 and type
absolutely. I was going to say that. There are two different types of diabetes, type 1 and type 2. And we're treating patients at our clinic with both type 1 and type 2 diabetes. And there is good news for those patients suffering from diabetes that they can actually get rid of their insulin dependence.
Wonderful.
This is good news for them.
Right.
So, whoever is suffering from diabetes, just, be reassured that
Okay.
the
Yeah,
but
stem
what is
cell
the process? What is the process?
The process is that we take stem cells from the patient's own bone marrow, and then we separate the stem cells that we need, and then grow it to the level that the patient requires, and it depends on their height and weight. So we grow it to that level and then transplant it back into the same person.
And for that, you have to send the stem cells to Turkey, and then they
Absolutely,
come
because
back.
there is
All
no
right.
GMP
So
facility.
this is how
Because
affiliations are working.
Yes.
But now let us just pick up on what are the other cures which are available, or probably how to expand it, and or
You
the
keep saying
extension.
cures.
You keep saying
treatments-
cures.
Yes. The treatments, right now, which are established are for type 2 diabetes, you can start with medications. There are excellent medications for that. And when medications fail, you obviously need to go on to insulin injections.
Okay. I'm sorry to interrupt you. I just want to bring up one aspect, because this is one aspect which is very important about the psychological impact of having diabetes. So for a lot of people, it is a very big deal that, oh my gosh, I need to find a cure, my life is over. On a very practical level, I want to ask Dr. Uppal, how severe can diabetes be? I mean, is it something that someone needs to hide from the world? Should we have a stigma attached to it? Or, is it something that we need to just raise awareness, because it's a very manageable disease?
In fact, for any disease, there is a denial factor. No one is willing to accept this hard reality. But as said before, it's a metabolic disease.
Right.
Once someone is having diabetes, it is not a very big deal, first of all. One can have main lifestyle modifications,
All right.
and through those lifestyle modifications, much targets can be attained.
Okay.
And the rest remaining can be topped up by adding some oral medicines, if not oral, then insulin, if that is the type 1 diabetes. Last month, I remember one of the patient came to my clinic. She's educated from the educated family. And I was talking and emphasizing on the activities, and she pointed out that how come Wasim Akram, having very active lifestyle, is suffering from diabetes? Why are you convincing me to have that lifestyle?
Oh, right.
Then
okay.
I was very convinced the question she put forward, but the reality remains, because I said that there's an answer to that question scientifically, because he's suffering from type 1 diabetes. And for type 1 diabetes, there is no insulin. There is no beta cell activity. So we need to give injection insulin in that form.
All right.
And certainly activity is going to benefit type 1 diabetic too. But we cannot say that if, for example, one such example has erupted where diabetes has diagnosed. On the basis of such examples, we should have definitely good activities. That is
Okay.
the main step.
So now I'll pick up on that, and let's move on to Dr. Mubashir over here. So what type of lifestyle modifications are we looking at? For example, if we have type 1 or type 2, and what type of foods are actually being prescribed that, you should actually have a cup of green tea early in the morning, have something
That's very
organic
good.
and stuff like that.
Very right.
Because modification sounds scary. People are like, modification, what does that mean?
Modification basically is a really threatening word. I think we can say we can adjust ourselves according to our needs.
That's what modification
That's very nice,
is.
yes.
though. I mean,
Very-
Let's
Just
make
a
it
bit.
simple.
All
Let's
right.
make it simple. So, for typically diabetic patients, I think they should have to avoid the most dairy products what in Pakistan we're talking about. We have. I think I hate to see when every corner we have the sweet shops. That's something really dangerous for this nation. This nation cannot afford that kind of food intakes.
Right.
Okay.
Even somebody diabetic or not. So even I met a lot of people in different meetings. They are diabetics, and when the sweet come, they say, okay, this little bit, let me have the taste a little bit on that part. So these things basically, when the late night, the late evening, they eat something which basically is a dense in carbohydrates form. So after that, they have only one thing to sleep. So these are the one factor we should have to avoid that one. Second, we need to avoid the red meat, too much. What we have here in Pakistan, I can give the one example. In one iftar party, I met a guy who was diabetic, and
Had his injection in his pocket.
injection in his pocket. And top of that, what he has in his plate, I think there's more than ½ kilo meat he put on the meat,
Oh,
plate
goodness.
to eat it after the iftar. So we must understand about our tummy. If we are already starving, and after that we should not take too much intake. So the whole meaning of saying in the day-to-day life, we should have the small portions, and maybe more than 2-3 times.
Okay.
Okay.
Right.
And the diabetic patient, if they're taking too much food on one time, they are hungry, they're feeling craving, and they take too much one time, and the whole day they never take anything. That's
dangerous.
very dangerous.
Whole grain is one very good addition, a good amount of fiber, and then
Oatmeal.
polyunsaturated like vegetable source oil. These are the main things which should be added in the diet.
Okay.
And then I see these days even the pedometers, there are good apps, and if one has the challenge of completing 10,000 steps a day is a very good idea.
Okay.
And I've seen
Well,
major
919
changes.
steps so far.
Oh, yeah.
And then we should avoid this halwa puri type of stuff on
Okay.
Sundays. It is
But at times you can still have it, right?
Okay, it's one thing, okay, because we are running very short of time, but one thing that seems that has been very consistent throughout is the lack of awareness and information. Although so many people suffer from it, we don't seem to take it so seriously. Like, you highlighted enough diary parties and in shadis, people eat the sweets and then go and inject themselves with insulin. I mean, that's the height of irresponsibility.
And then at the same time, they're not even loyal to themselves.
Or their
Exactly.
families,
They know that
it's
they've got
selfish.
diabetes, they'll still wake up midnight somewhere, go to
This is
the
a
break.
roller
as you were
coaster
saying,
situation.
Oh, everyone, okay, we've run out of time, so one last message from...
This is a roller coaster situation. Basically, they destroy the metabolic syndrome in more bad way. And the second, they should have to take more vegetables.
Okay, vegetables.
And specifically green colored vegetables, because they carry
Cooked in oil?
magnesium, zinc, all these factors are extremely important for the pancreas.
Okay. And oil intake should be decreased.
Even I also blame we doctors that sometimes we try to convince the patient that okay, you should start insulin and then you can take everything. It is important that we should also tell at that same
No,
time
no,
that
don't tell them that.
Okay, then I
take
just have-
insulin and keep building healthy lifestyle and
Alright.
eating habits.
I just have two small questions before we wrap up.
Wait,
and they're
okay.
very important.
Okay,
Dr.
go.
Mubashir, be very precise about it.
You looked at 30 seconds.
48% of the population is malnourished in Pakistan. So, when you'll pick up on regions, how do you think you'll manage it, first of
Yeah.
all?
Right.
Go ahead.
With the malnutrition.
Wonderful. I think I very much convinced on that. Pakistan is not malnutrient country, should not be. But this is about than 95% right now at this moment. The point is, if we take right vegetables, food on time, less portion, 3 times. We people have the bad habits. I have the lot of answering from the people. Oh, I have less breakfast,
Okay.
but I have the great dinner.
All right.
So that's bad thing. We should have to balance
A balanced diet.
to get away from the malnutrition at the grassroots level. Even say in the third area, the malnutrition. If we have the milk and dates,
Okay.
how we can be malnutrition country?
I'm
All
so
right.
sorry, Dr. Bashir, but we ran out of time. I'm sorry, Dr. Salman, one last word from
But
you.
before the word,
No, no,
one
you
last
can't.
thing,
You
one
can't ask
last
the question.
thing.
You
Let me,
can't ask the
please,
question.
please.
You can't.
All right, so now what I want to know is,
Okay.
what other diseases can diabetes lead to? That's it.
A lot of diseases. It affects every single organ of your body, starting from your brain to your toe.
Okay.
Just to give
And you can actually lose like
Yes,
limbs, organs
absolutely.
and your
Exactly.
limbs and stuff if
Absolutely.
you don't treat diabetes.
small, frequent meals, exercise daily, take it seriously, get the blood test done.
Great. Thank you so much for your time and thank you for being here today. I hope you guys took something away from that. At the end of the day, if there's any change in your drink thirst, hunger, and your visits to the bathroom, do go and get a check, because at the end of the day, we are all prone to it now because of our lifestyles and the way we're leading. So look after yourself. Without your health, you have nothing. Do log on to our Facebook fan page,
Which is with the name of World This Morning.
our Twitter page,
World This Morning without a G.
our Daily Motion page,
And YouTube page is
YouTube
World This Morning.
And the repeat is that.
5 past midnight.
Have a wonderful day and we'll see you bright and early.
Stay healthy.